All right. Thank you everyone for joining us today. Thank you to our panelists for joining this session and chatting a little bit about this important research. I'm excited to be moderating the conversation today. I am the Chief Research Officer at Greenwald Research, and I have a interest in mental health and healthcare. I'm going to introduce my colleagues. I've got Greg Hirschberger, who's our Managing Director of Health and Benefits, and Lisa Wyszynski, who is one of our associates, and she is primarily works in the health and benefits space as well. Some housekeeping items. We will be recording this session, as you were warned when you joined. That recording will be available on our YouTube channel, links on our website as well. If you have questions, feel free to put questions in the chat, and we'll do Q&A as we go. But if you want to chime in on any of the findings, feel free to jump in as we go. Before we dive into a teaser of some of the interesting things that we found for this project, Millennial Mental Health, I wanted to cue up the genesis of this actual project. So bear with me a little bit. Greenwald commissioned an incubator, a research idea incubator. And so we invited our staff to come up with ideas on topics that were relevant, interesting to them, without any Greenwald staff member to pitch an idea. And those presentations, the ideation, presentations and selection essentially happened in a sprint format, about 7 business days from inception to selection. Really quick process there, right? So looking for interesting projects. We really wanted them to be in the health benefits or financial services space. And we got 5 different submissions, 6 different staff members, had a couple team up together. We actually funded 2 of those projects, partially because we had such trouble picking among the submissions. Our first project was cryptocurrency and retirement. That one released back in the fall. We had a coffee break in September. So if you're interested in learning more about that, there's some content on our website. The other project is this one that we're talking about today. That is about mental health care among millennials. Just want to make a wording note. So today we're using terms interchangeably: behavioral health, mental health. Really what we're talking about today is how individuals might need some emotional or mental health support from a care system. That care system is usually referred to as behavioral health services. So really the realm of things that we're talking about today are things like counseling, therapy, stress management, diagnosed mental health conditions like anxiety, OCD, depression, also substance abuse. So that's a sort of full gamut of what we're talking about today. So just bear with us. We do use those terms interchangeably. Obviously, mental health, well-being, really hot topic right now. It's one that's really important to have conversations about. And it's one that I've personally been interested in over 25 years at least. Like many of us, my interest was piqued by personal experience. So I watched my loved ones navigate a very fragmented, disparate mental health care system when my grandmother was struggling with serious depression. And so that really formed my interest in the topic. And just like a lot of us, right? What we do as researchers is really driven by our lived experiences. We're watching others around us struggle with something, and we wonder, what else is happening in the world? So Lisa Wyszynski was the idea creator for this great topic on millennials and mental health. And so, Lisa, I'm hoping you can tell us a little bit about where you were coming from as you chose to pitch this idea for our incubator competition. What was interesting to you about this topic?
Well, so it's no secret that a lot of people were struggling during the pandemic with their mental health. I was a bit, and my millennial friends were as well. In some cases, it was a lot more than they expected. a lot of people I know were looking for in-network therapists, and they were really struggling to find them. There was already a shortage before the pandemic, and therapists were booked up, and other mental health professionals, people couldn't find them. And so they were trying to get out-network therapists or professionals or really whatever they could get. And that made me wonder if our experiences were reflected in our generation as a whole. And given that people weren't able to find in-network help, I was wondering if there was going to be financial issues going along with that, given the high costs of healthcare in the mental health space. So I thought it'd be interesting to look into. So I made my pitch and I really started from there.
Great. That generational component is really interesting to me as well, right? When I think about my grandmother and the things that I saw with her generation and not really talking about mental health at all. And now we have such a shift in how we talk about mental health as a generation. A good thing, I think, that we're a little bit more open in talking about mental health. But COVID really accelerated this conversation for everyone. So really timely topic, obviously, one of the reasons we wanted to do this project. So can you tell me a little bit about what you wanted to accomplish with this particular project?
Yeah, so there are four main objectives I came up with whenever I was coming up with this research that I thought would be interesting to look into. The first was understanding the importance of healthcare. So how many millennials need care and how many really tried to find care in the past 12 months. The second was how they were accessing care. So how they're looking, whether they're just doing Google searches, whether they're going to specific websites, whether they're going through word of mouth maybe, and who they're seeing and whether they were able to find anybody in network or out of network, I thought would be interesting. And then what barriers they face in accessing care, whether they were actually able to find a provider after their search, and if they used various methods such as the insurance website or Google or what have you, how that can be improved. So if they had issues finding care because of their method, how that could be improved in the future for people looking. And then lastly, how paying for mental health care impacts millennials financially. So how much people are paying for their care, whether it's the appointment themselves or prescriptions for medication, what financial issues people are facing, whether in mental health care as a whole or really their whole life, such as paying bills or paying mortgages and such. And then how paying for mental health care might affect that. And that was for both people who were able to find help in network and people who were able to find help out of network, whether that made a difference.
So let's talk about what you found, a little sort of teaser here, because obviously a lot of really interesting things in the white paper that we put together. Can't cover it all in a short coffee break here. So let's talk main theme, right? So theme number one, what's the state of need for mental health services among millennials?
Well, the need's pretty great. Millennials, we found, are not in great health. The national average for people who say their physical health is excellent or very good is about 52%. Among our millennials that we surveyed, they rated 44% said that their physical health was excellent or very good. So that's below the national average. And then their mental health is even worse. Only 36% said that their mental health was excellent or very good, and a full third said it was fair or poor. So it's clear there's a need. And it's clear that people are searching. 55% of millennials say that they needed mental health care in the last 12 months, which is a large amount. It's more than half. But what's really interesting to me is that 2/3, 67%, tried to find a professional in the last 12 months, which indicates a greater need for mental health care among millennials than they may want to admit or may even be aware of. And that's really important because unmet mental health needs slide into physical health. So if they aren't getting mental health taken care of, that can affect their physical health. And then that can lead to more use of more expensive options, such as urgent care centers or hospitals, which can really lead into financial issues.
Yeah, that part in the white paper, and there's more detail around that, about how that mental and physical health connect, right? That's I think, really important to point out. It's an idea that, from sort of medical physiology and my background, has been around for decades. But I think it's finally mainstream now. We're talking about that sort of mental physical health connection. We're now even tying in financial wellness in that. So it's a really, I think, interesting finding. So clearly, lots of need. So are millennials getting care that they need? How are they getting that care? How's that going?
It's not going bad. Millennials are able to access care in a variety of ways. So of our privately insured millennials, 79%, or about 4 in 5, are seeing at least one mental health professional. Of those who say they have a primary professional, 30% say that professional is a therapist. And interestingly, a full quarter, or 25%, say it's their PCP. So that really indicates a reliance on PCPs in a variety of areas. And 3/4 of those seeing a mental care professional say that their professional is in network, and 9 in 10 have at least some reimbursement, even if they're out of network. But given the reliance of PCPs that we see, it would be interesting to see if that's really affecting the results at all.
I mean, millennials are a big generation, right? The biggest in the US currently, at about 72 million people. So when I think about these results, right, 79% saying they used at least one provider at least one time in the past year. That's a minimum of like 57 million people visits to providers. That's a lot of attempted visits to providers. We hear in the news that there's issues with accessing providers, shortages of providers. So Greg, what happens, right? What happens when these millennials go to seek out care? How does that go?
Well, short answer is it's not super easy. We asked how easy was it to find a mental or behavioral health professional? And while 2/3 say it was very or somewhat easy, you still have 33% who say it was somewhat or very difficult in finding a mental health professional. So how are they using it? I don't think it'll be a surprise to anybody. The top rated tool to find care is Google. 68% are turning to search engines to look for a provider. But just below that is the health insurance company website. And here's where I think there's an opportunity for health insurers to help millennials better navigate the care system, because 24% of millennials say it was difficult to use their health insurance company website to find mental health providers, and only 43% said that it was the most useful tool. While that was the most useful tool out of all of them, still only 40 some percent, not great. So what would make the search easier? 21% say that they would like a clearer list of providers on the insurance company website. 16% would like more clarity on in-network versus out-of-network providers, and a similar share would like more information on what their provider's specialty is. So there seem to be the top things that would make the search easier are all related to the health insurance company and their website and kind of how to navigate that. And I just, before we go on to the next slide, wanted to touch on the other tools that are being used to find care, and much less frequently than websites, search engines, and the health insurance company website is a referral from other medical professionals. Only 34% are using that, and I think we can tie that back into Lisa's slide where we looked and saw that a very high number are using their primary care physician for mental health services. And those are the folks who are typically referring people out. So there's maybe a little bit of disconnect there in getting the specialization that you need. And instead, people are relying on their PCPs or more general practitioners where they may need more specialization.
It's really interesting. Not surprising, right, that millennials, that digitally sort of connected generation, really lean on those digital tools for seeking out behavioral health services, but obviously a gap there in terms of what they are expecting, sort of the personalization and the detail that they need to sort of navigate that care system. So let's pivot a little bit. Let's talk about finance, right? Because Lisa's impetus here was, what's happening, right? You've got to use these mental health services. How does that tie back to financial health? So Greg, if you could tell us a little bit about that health wealth connection for millennials.
Sure. So want to start by looking at the biggest financial stressors for millennials. And you'll notice way down on the list is mental health care or insurance not covering their mental health care. Only 1% say, as they have a huge truck drive by, excuse me. Only 1% say mental health care is their biggest financial stressor. But when you look at the items above on the list, it kind of makes sense. I mean, 16% worried about not having enough left after all the bills are paid, inflation or the economy, and then things that are, you have to do. You have to pay your rent, you have to pay your mortgage, you have to be able to put food on the table. So mental health care is a little bit down on that list. But at the same time, people are spending a decent amount of money on their mental health care. So one number that kept on popping up here is 60%. 60% of those who have used a mental health professional in the past year spend at least $50 out of pocket per visit. And more than 60% have at least 2 visits per month. And then also an additional 60% are spending at least $25 per month on mental health prescriptions. So when you extrapolate those numbers out, you're looking at an expense of at least $125 per month for more than half of those who are using mental health services. So that's, on par with something like car insurance. And I know some people who will forego having cars so they don't have to have that insurance payment. So it's not an insignificant expense.
Yeah, I mean, average millennial salary is about $47,000, right? So if we want to look at post-tax income, because people are paying for these visits with their actual dollars, maybe they're seeing $35K a year in actual dollars. That's $2,900 a month in income post-tax. If you're spending $125 a month, that's 4% of your monthly income going towards mental health care at a minimum, right? That's not include, you got to pay for your mortgage, where you're living, right? Mortgage or rent. You've got to pay for food, basic necessities. You have to pay for that insurance in most cases.
Mm-hmm.
There's some premium there. So, so how is this impacting millennials financially?
Sure. So, while paying for mental health care is low on the list of financial stressors, we did find that those with poor self-reported mental health and those who need and are using mental health services are more likely to suffer adverse financial situations. So looking at the actions in the past year that millennials have had to take, 53% say they've cut back on optional spending like travel, clothing, or entertainment. So that's what you would expect to be at the top of the list as kind of the first line of defense when it comes to tightening your belt. But then go down just a couple. You getting a third paying a bill or making a debt payment late. Another third dipping into savings to pay for expenses. And this one I think is a really big one. 1/4 of millennials have had trouble paying everyday expenses like buying food or utilities. So that's obviously a big issue. And when you look at that list, what's not on the chart is again that those in poor mental health are more likely to have taken every one of those actions. Then looking specifically at delayed care due to cost in the past year, those with fair or poor mental health, 38% say they've delayed making medical appointments, compared to 23% of those with excellent or good mental health. When it comes to mental health care specifically, 29% of those with fair or poor mental health have delayed mental health visits, compared to only 12% of those who report their mental health as being excellent or very good. So while, again, they say it's a low financial stressor, it's pretty clear that poor mental health and financial difficulty are highly correlated.
Yeah, and I mean, this is a group that's in prime earning year, prime saving years for retirement to see that 4 in 10 are reducing how much they're saving is striking, right? The financial implications of that for years to come. But also the link back to physical health that Lisa mentioned earlier, right? You're delaying those medical appointments that can have implications for your health long term. So while I wait to see if there's any questions that come through in the chat box, I had a couple of things that really stood out to me when I was reviewing that white paper. And my first one is, and I can say this as sort of that, I guess I'm a zennial, right? X and millennial, I'm in that weird cusp group that sort of relates to both groups. But Lisa, like, are millennials okay? Like, how bad is this?
It's pretty bad. We're not okay. I can say that as a millennial. We've got about half of our millennials who admit or say that they need mental health care services. And among those, 3 out of 4 or more really report feeling a variety of indicators of poor emotional well-being. So that includes things like difficulty focusing on tasks, losing interest in activities, struggling to sleep, and feeling overwhelmed. So that's really not great.
Okay, maybe that's a good thing, right? So you've got a proportion, millennials, I need help, I'm struggling, they're trying to get that help. Okay, so then you have the 45% or so that are like, hey, I don't need services, right? They're doing okay, maybe?
Well, I mean, you would think so, but really not so much, we found. Between a third to a full half of the millennials who said that they did not need services actually have those same indicators of poor emotional well-being. So that's, again, things like losing interest in activities or feeling overwhelmed or lonely. So really, there's a lot of unmet need out there, and people who say that they might not need help may actually need it after all.
So people are not okay.
No, no.
All right. So Greg, something I wanted to ask you about, and this sort of comes, from this huge demand for services. We see stories about it in the news. We're seeing it in this research. Millennials seeking out care, variety of places, in network, out of network. Can you talk a little bit about that in network, out of network distinction? Because I think that was one of the things we went in curious about.
Sure. So yeah, we did. And what we really expected to see were large differences between those who were accessing care in network versus out of network. But that ended up not really being the case. So while it is true that those using out of network providers are on average spending a little bit more money out of pocket to access that care, satisfaction with the care is actually on par with those using in-network providers. And maybe even more surprisingly is that satisfaction with the cost is also pretty on par with those using in-network providers. So what does that mean? It may show that millennials are just happy to have access to these services at all. They may place a high value on the services and think that they're getting value for the money. It may also indicate some level of selectivity among millennials in wanting to find a provider that's right for them, even if they don't happen to be in the network. Although we did find that about 7 in 10 of those using out-of-network providers would switch to an in-network provider if they had the chance. So that may not necessarily be the case. But yeah, I thought it was very, very interesting findings in network versus out of network, both highly satisfied with cost, highly satisfied with their providers. Although I'm sure, as the 70% indicates, some wouldn't mind having lower costs for their mental health care.
Yeah, I mean, it tells me that they're really just doing the best to get by, right? I had a question that came through. Okay, so this question is talking about this slide, right? So those who are in worse mental health, right? They're delaying care even more, right, than those in excellent or very good mental health. So
Right.
Ripple effects, right? Like ripple effects of those needing care the most are also exacerbating or potentially getting even worse because they're now having to delay therapy or mental health, stretch those visits maybe more than they need to, put off those medical care appointments. I guess that's not really a question, right?
Yeah, and I mean, I think it's one of those things that is kind of a chicken and egg issue, right? Am I struggling financially due to kind of having some mental health issues? Am I having mental health issues because I'm struggling financially? And probably it's a little bit of both, right? And they definitely are going to exacerbate one another. But obviously what you want the least is somebody delaying care because they can't afford it.
Right. I mean, it's the opposite of all of the trends in health insurance and healthcare, right? Preventive appointments, staying on top of those things, prevent higher costs down the road. That's an issue for insurance companies, frankly. And you're talking about 72 million millennials. Are they creating a tsunami to come of health issues, even more so than we're seeing right now? So thank you so much for that comment from the group. I wanted to mention, because we've touched on it briefly and we're getting close on time, the white paper will be available for purchase. These are some of the key questions that we have answered in that white paper. So that information will be sent out soon. I believe it's going to be available in the next couple of weeks. $1,000 for the white paper. If you're interested in seeing the banner tabulation, like all of the subgroup analysis, etc., happy to provide that to you for an additional fee. So those are the questions that are answered in the research. I'm not seeing any other questions, comments, thoughts come through, but wanted to plug that we have all our coffee breaks available on our Coffee Break Hub page. You can find us at www.greenwaldresearch.com. You can connect with us on LinkedIn. And I look forward to continuing the conversation with everyone. So please connect with us. And thank you so much, Greg, Lisa, for doing a quick teaser, little preview of this issue. I think it was really helpful today.
Thank you.
Bye, everyone.